That's a very important consideration, patient confidentiality. Because I'm a patient, I see a doctor, so I share 100% of what I know with you because you need that information to give me the relevant care. Now, I don't want that, some of the information may be private information, and I do not want that information to be just easily passed on, unless it's to another healthcare worker who needs to know in order to continue the care with us. So patient confidentiality is a very important part, whether your medical records are in paper form or in electronic form. That is always a consideration, and that's why the hospitals, for example, medical records office, access, entry, it's just like library. You have to make sure we know who are accessing what, and there must be a log of it. But IT is the same thing. But in fact, IT makes it easier because I can have a good mechanism of monitoring who access whose medical record, when, what time, and so on. Whereas in a medical records office, if I'm a doctor, I can just walk in because it's just like a library. And unless you put CCTV all over the place, very hard for you to monitor, right? As a doctor, which medical records have I accessed? Whereas on the IT platform, you can do that. So for example, if I'm a consultant, I have 20 patients under my care, and if I access these 20 of class records, then it's reasonable. But if one day you find a doctor or a nurse who access 300 patients' records, none of them, or most of them, are not his personal patients, then the IT system can alert us, and then we can investigate. So, yes, confidentiality is a key issue, but it can be managed. And that's how the financial banking sector operates. Because financial data, assets, how much money in your bank account, all those are very sensitive information too. But IT in banking has been around for decades.